Good morning and welcome to the De-Escalation and Conflict Management webinar put on by Behavioral Health Services Baltimore and Harm Reduction Coalition. My name is Casey Bishop. I am the Capacity Building Services Manager at Harm Reduction Coalition, and I am going to be talking to you all about de-escalation and conflict management today. But before I get started, just a little bit on Harm Reduction Coalition. Harm Reduction Coalition is an organization that does advocacy and policy work as well as capacity building and training work all around the U.S. We were founded in 1993 by a group of syringe service providers, people who use drugs, and their allies. And we now have presence all over the country. Our two headquarter offices are on the East Coast in New York City and the West Coast in Oakland, California. But we have remote staff in Baltimore and Washington, D.C., Louisville, Kentucky, Memphis, Tennessee, Alabama, Texas, all over the country. And we do work in these 5 buckets. We do policy and advocacy work, so state and national policy work around expanding access to certain service programs, medication as treatment, and naloxone access. Trainings and technical assistance, that's what you're experiencing now. We have a capacity building department that does webinars like these, as well as in-person trainings all over the country. We do overdose prevention work, both in New York. Our medical director, Dr. Kim Soo, oversees the standing order for many of the New York syringe service programs to distribute naloxone, as well as many of the pharmacies that distribute naloxone in the state. And in California, in our West Coast office, we have the DOPE project, the Drug Overdose Prevention Education Project, which distributes naloxone directly to folks who use drugs in San Francisco. We also put on national and regional conferences. Depending on when you are listening to this, our conference may be coming up. At time of recording, our 2020 conference is slated to be in San Juan, Puerto Rico in October of this year. So if you're listening before October 2020, highly encourage you to check out harmreduction.org/conference and consider coming through. Our conference is a lot of fun and super educational. It's, in my opinion, the best way to make harm reduction connections with people all over the country. And we have a number of resources and publications on our website. So lots of resources that you can either order that will look pretty like they do in the photo, or download as PDFs for free and print out for yourself, your participants, your clients. Also more webinars just like this one. So highly encourage you to check that out if you are curious about more harm reduction information. All right. And we also have a North Star statement here at Harm Reduction Coalition to guide our work. So that North Star statement says that Harm Reduction Coalition creates spaces for dialogue and action that help heal the harms of racialized drug policies. So we felt like this was a really important statement to introduce to guide our work about 2.5 years ago, because as there's more and more attention given to the current overdose crisis, a lot of the money, a lot of the empathy and sympathy is being directed towards upper middle class, majority white communities. And we recognize that prior to this, during what was referred to as the crack epidemic, and for centuries, decades, communities of color have been punitively impacted by harsh drug laws, have been imprisoned, have not been given the empathy that we're seeing in the current overdose crisis. And we always want to remain focused on the harms that they've experienced, because truly these racialized drug policies harm us all. All right, and with that, we'll get started with the webinar content. So today's purpose is to provide some strategies for identifying what escalation looks like, and a plan that everyone can use to manage conflict, as well as tools to support people through the de-escalation process and the conflict management process. All right, so that was our little overview module. Now we'll talk about conflict and escalation and what these two words mean. So what is conflict? take a minute, and if you're watching this webinar with someone, talk to each other about what conflict is, what you think of when you think of that word. I'll give you 30 seconds to a minute to discuss. All right. So conflict is a disagreement in which those involved see a threat to their needs being met or their concerns being addressed. A key element of conflict is the idea that each person has a different perception of any given situation. So that's really important to keep in mind throughout this webinar whenever you are experiencing conflict. There are multiple truths in every situation. Everyone has a different perspective as to what's happening. And conflict doesn't exist in a vacuum. People involved in any given conflict bring with them histories of other conflicts, their feelings, both current and past, their current mood, their past moods, and their perceptions of the situation and of the person that they're experiencing conflict with. So, conflict is not, as it says right there, conflict doesn't exist in a vacuum. It can't be isolated. We bring our full selves to conflict. So I'm going to give you an opportunity to think through, again, if you're watching this with anyone, what certain examples of conflict that arise in your organization have been or are. You can talk with your colleagues about this, or I can just give you some examples of conflict that I've experienced being a certain service provider. I have experienced conflict in the drop-in center where I used to work around food and food scarcity and people feeling like if other folks took multiple of any food donations we had out, there wouldn't be enough for them or their friends when they were hungry. There has been conflict over what folks are going to watch on TV. There has been conflict with staff over the regulations and rules at our organization. There have been conflicts in terms of people waiting for the syringe service program. Tons of conflict. And what does it mean when a situation is escalating? What does it look like? What does it feel like? What does it sound like? I really encourage you to think through this. And again, I'll give some examples. I know that often when a situation is escalating, I see people invading each other's personal space or speaking more loudly or in some cases more quietly. I have seen people's body language change in terms of clenching their fists, crossing their arms, maybe clenching their jaws. It feels tense. There's an anxiety and tension in the air that may not have been there before. And in my experience, those are some things that I see or feel often when conflict arises. So I want to talk to you about the stages of escalation. So escalation happens on a continuum. I don't want you to think of these things as separate from each other. That's why, there's this color continuum. But escalation often starts with anxiety. So people experience a trigger, might give each other a dirty look, might increase their psychomotor activity. I know that sometimes I see people pacing when they're feeling really anxious or moving towards belligerence, which again, might see more of that increased psychomotor activity. People might be increasing or, as I just said, decreasing their volume. People might have an increased use of profanity, name calling, and that can also move into or be part of aggression, where you might see people slamming objects or being violent towards other people. And aggression can really quickly turn to extreme danger with a use of implement or weapon to harm, or, even actual person-to-person violence using just our hands can be extremely dangerous. So these are the stages of escalation: anxiousness, belligerence, aggression, and extreme danger. And again, there is no perfect line between each of them. There are these fuzzy areas where someone might be anxious and becoming belligerent, or someone might be belligerent and becoming aggressive, and so on and so forth. So what's de-escalation, now that we've talked about what escalation looks like? Well, de-escalation is a technique that is used during any potential conflict situation, or can be used during any potential conflict situation, in an attempt to give a person or multiple people space to express and process their emotions in a safe way and reduce the chances of them causing harm to us, themselves, or others. And I would say just as important as what de-escalation is, even maybe more important, is what de-escalation is not. De-escalation is not a teaching opportunity. It's a chance for folks to learn, for you as well as the people involved in conflict to learn, but it is not the time to teach. It's not dealing with a nuisance. It's not just brushing away someone who's being annoying. And it is not something you will only ever have to do once. If you are working with people, you're gonna experience conflict on a near daily basis, and you're going to have to de-escalate conflict on a near daily basis. That is just the nature of person-to-person harm reduction work. Now, part of intervening or de-escalating effectively in a crisis situation or a conflict is helping the participant feel an immediate de-escalation of anxiety, fear, and panic. So we are not de-escalating when things are in aggression and extreme danger. At that point, it's intervening, but not necessarily de-escalating. Ideally, we are going to de-escalate during the anxious and the beginning stages of belligerence phases, because that is when people are feeling that anxiety, that fear, and that panic, and it hasn't risen to a dangerous situation yet. So it's really important to, if we can, intervene and de-escalate when people are feeling anxious or belligerent, because de-escalation tactics are much less likely to work if aggression has already started. Now, we can't talk about de-escalation without talking about trauma and conflict. I hinted at this at the beginning when I talked about how people bring their full selves to conflict. So, you know, conflict is not isolated. It doesn't exist in that vacuum. People are bringing their histories and pasts, and often they're bringing very traumatic histories if they're program participants of a syringe service program. So I'm going to walk you through these definitions of trauma. Acute trauma is a single time limited event. So it might be a car crash. A car crash might leave someone with acute trauma, right? Chronic trauma is multiple traumatic exposures and or events over extended periods of time. So someone who has been in an abusive relationship or grown up in an abusive household has experienced chronic trauma. And then complex trauma, experiences of multiple traumatic events and the impact of exposure to these events, often occurring within the caregiving system, right? So people who experience childhood abuse, who see parents with mental illnesses, who are taken away from their parents, who experience poverty and experience the impacts of having lights turned off, waters turned off, etc. in their homes, often show up to situations with a history of complex trauma. And then toxic stress is when adverse experiences lead to strong, frequent, or prolonged activation of the body's stress response system. So people have a really super high heart rate, or breathe quickly, things like that, because their body is in a constant state of stress. And then secondary or vicarious trauma is exposure to the trauma of others by providers, family members, partners, or friends in close contact with the traumatized individual. So all harm reduction service providers are at risk of secondary or vicarious trauma because we see and witness these really people who are experiencing trauma, whether it's complex, acute, or chronic. We work with people who are experiencing varying levels of trauma all the time, and that can lead to our own trauma. So it's important to remember that not only do participants or clients show up to conflict with these histories of trauma, but we as service providers do as well, both because often we're in the work for very personal reasons, and because as part of this work, we experience secondary and vicarious trauma. So what are examples of trauma experienced by the participants you serve? Again, I'm going to ask you to think about it. I'm going to give a 10-second pause and then list some examples of trauma I saw experienced by the participants I served. So, all right, so I will try to give 5 to 7 examples of trauma I saw my participants at the certain service program I worked at for 7 years experiencing. Trauma related to the criminal legal system and the carceral system, right? So the trauma of arrest, of spending a night in jail, of spending a week in jail, of going to prison, of having to go to court. The trauma of being kicked off their medication for positive urine screens. So the trauma of being cut off cold turkey from their Suboxone or buprenorphine or methadone. Trauma of the foster care system and of child services, of having their children taken away. Lots of them had experiences of street homelessness, which is a traumatic experience. I already mentioned abusive relationships or abusive childhoods. Many of the participants I served had experiences of abuse. The trauma of staying in a shelter and not feeling as though you or your belongings are safe. Overdose, whether someone else's fatal overdose or their own overdose that they survived. Many of my participants had first or secondhand experiences of overdosing. And these are just 7 examples of some really intense traumas that people showed up with to our program every day, right? So participants are experiencing trauma. And when people have the history of trauma and they're engaged in conflict, this means that sometimes people react to things that we might perceive as small in a way that doesn't seem proportionate to someone who doesn't know why they're reacting that way to a right? So I gave the example of, at the program I worked at, people fought over the food, right? So for me, someone taking 2 of the soups that had been donated might not have seemed like a big deal, but for someone who had lived without food for days on end and was worried that they wouldn't be able to pick up a soup when they saw someone taking 2, it didn't feel proportionate, or it didn't feel like such a small thing. It felt like this person is limiting my access to food, and that can feel scary and triggering. Another thing that we really need to be aware of when we de-escalate situations or talk about de-escalation is the power imbalance between participant and provider. So power dynamics really help us to understand a situation better. And providers and participants don't have fair power dynamics, right? I can be the best provider that I possibly can be. I can be kind and fair and patient with participants, and I still am providing syringes or pipes or a warm place to sit down. I'm still providing something that they need, and I still have the power to take that away. And so I have power in that situation that a participant doesn't, and that can really contribute to feeling traumatized, to a participant feeling traumatized in a situation, to the ways that participants react to triggers and to the way that conflict plays out in the space. That said, there's also a myriad of other power dynamics that are rooted in oppression, marginalization, and stigma that can play a part of any interaction. So it might not just be about provider-participant, it might be a conflict between two participants, or even in a conflict between provider and participant. These identities and histories play a role, right? So race, ethnicity, and nationality, someone who is white and a citizen of the United States holds power over a person of color, and especially over someone who is undocumented. Stigma related to drug use, homelessness, and mental health, right? Someone who presents as a person who is not perceived to be a person who doesn't use drugs, or who is not currently experiencing homelessness, or who has more stable mental health, might have power over someone who is currently seen as a person who uses drugs, or who is currently experiencing homelessness, or who doesn't have access to mental health medications, right? Gender presentation, and sexuality, right? So straight cisgender people often hold power over queer and trans folks. And then poverty and access to resources, right? So people who have the money to access resources hold power over people who don't. So again, more things to consider, more ways that the situation, the conflict can be impacted, right? If I am having a conflict with, if I as a queer woman who is a provider, I'm having conflict with a white man who I provide services to, I hold some power in the fact that I'm the provider and I am holding access to the resources that he needs. But he holds power in terms of gender and gender creation. So power dynamics are not as simple and clear-cut as you may think. So all of this said, now let's talk about some strategies for de-escalation. We've talked about the history, we've talked about trauma, we've talked about power, and how power can be unbalanced in a myriad of ways. But what does de-escalation look like? What do we actually do when we de-escalate? So I'm going to invite you to think about a personal crisis that you faced. What did you feel during that experience? What did you want from others? What helped you deal with that crisis? And I apologize for the sound in back. Apparently I had not muted my computer. So I recently had an argument with my best friend, a conflict with my best friend. And during that experience, I felt really tense, really upset, really unclear on what the conflict was and why it was occurring. And I wanted an explanation from her. And so what helped me deal with that crisis was to take a minute, sit by myself, reflect on what had happened, reflect on what I might have done wrong, reflect on what I wanted to say to her. And then what really helped was us being willing to talk it out. So yes, I invite you to think about a personal crisis you've faced and what was helpful and maybe what wasn't helpful. So a conflict management tool that I am going to introduce you to is SPLAT. And SPLAT is a really cool conflict management tool that was developed actually by the Florida Department of Transit. This is a training that they give their bus drivers, which makes sense, right? Conflict definitely breaks out on public transportation a lot of the time. So SPLAT stands for self-control, prevent, listen, adapt, and think. SPLAT. Self-control, prevent, listen, adapt, and think. So when you feel your own emotions escalating, what are some strategies you use to calm yourself down? I know for me, I twist a ring that I wear every day. I close my eyes and take a couple deep breaths. Writing about my feelings really helps me to calm down. But even if I can't do any of that, just closing my eyes and taking a deep breath or rotating that ring a couple times really is helpful for me. So I encourage you to think about what's helpful for you. What about when someone else's emotions are escalating? What do you do? What do you feel? I know I start to feel really tense. And again, deep breaths are helpful, but if it's a situation in which I need to be there and present, I might not be able to close my eyes and take some deep breaths, right? I might just have to take a deep breath with my eyes open. So how you might adapt your trauma responses when other folks' emotions are escalating versus your own is something to think through. Now, let's talk about the value of self-control. Once you step in to manage a conflict or de-escalate a conflict, you become a part of it. So don't react, respond. So when we say don't react, respond, we mean don't be reactive, be proactive in your response. So be proactive about how you are approaching people, about how you respond to the situation. So don't wait for a time to react, right? Don't wait for the conflict to move into aggression or danger. If you see someone becoming tense or belligerent, if you hear people arguing, or if you see someone increasing their psychomotor activity, respond. Ask them what's going on, what you can do to help. And then also be aware of your own trigger points, right? Be aware of what throws you off in a conflict. Be aware of what you can't work with and what you need support around. Share that with your team. Share that with your colleagues. Look out for each other. Work as a team. So, what are some behaviors or situations that can cause you to react instead of respond? And how can that escalate situations, right? So I know for me, being spoken to disrespectfully about my gender or gender presentation really triggers me and causes a reaction in me. Or hearing words of violence, particularly against women and femme presenting people, triggers something in me and leads me to react. So just act from emotion rather than respond rationally, which can escalate the situation because then I might not be in control of my tone or my volume. I might not understand how what I'm doing or saying is impacting people. I might be using hurtful words or words that are born out of hurt, right? So thinking through what some situations that bring out emotional reactions in you and sharing them with your team can be really helpful. So in order part of conflict management is prevention, right? In an ideal world, we could prevent all conflict. And unfortunately, we don't live in an ideal world, but we can prevent some conflict by being really clear with folks and by following these steps, right? So prevention is structural. Conflict doesn't arise out of some bubble. Again, conflict does not exist in a vacuum, right? There are things in your program structure that might make conflict more likely to occur, right? So when you speak with participants or when new participants come to your organization, be really clear on your community guidelines and make sure that all staff are perceiving community guidelines the same way. Give your participants a copy of the community guidelines. Going down to step 4 or Point 4, take feedback seriously. If someone says, hey, this guideline doesn't feel right to me, it doesn't feel safe, it doesn't make me feel safe in your space, ask them why, talk to them about it, hear them, be open to changing that, right? Something that I talk a lot about when I give de-escalation trainings is how community guidelines or agreements or policies and procedures prioritize staff comfort over participant safety. Now, staff and participants have to be safe. That is number one, right? But a lot of program policies and procedures that I saw were more about staff comfort than participant safety, right? Or that I experienced in the program that I worked with, right? So go through your policies and procedures, really interrogate them, ask what fits, what doesn't, what is about staff and participant safety, what's about staff comfort, really think through it. Also be aware of your surroundings. And I don't mean just like what's directly in front of you. Be aware of what's happening on the periphery. Be aware of the structure of your building and how it might breed conflict, right? Our drop-in space was really small at the program I worked at and got packed really quickly. And when people are packed into a space on a cold day or a hot day, it can really make conflict escalate more quickly because people are feeling stressed, like they don't have space, right? We talked about taking feedback seriously, but again, solicit participant or client feedback, ask them what works and what doesn't, take that feedback seriously. And then relationships promote resolution, right? So it's going to be a lot easier to de-escalate a conflict if you have an existing relationship with the participant than if you don't. It's really important that you develop relationships with participants if you're able to, because they're a lot more likely to be open to speaking with you about what conflict is happening and to finding a resolution if they are open, if they are open to hearing from you. All right, so again, just to reiterate, building relationships will make it a lot easier to find resolution to conflict with participants or between participants than just intervening or responding when situations feel sticky. So what strategies do you or your team use to prevent conflict? What are some structural adjustments that could help? So I know for me, when I was working at the Stern Service program that I keep referencing, instituting clear bathroom policies that we solicited feedback on from our participant advisory board was a really helpful structural adjustment that decreased conflict over the bathroom, making sure that people were aware of time limits of when we were going to open the bathroom up, of when they could or could not use the bathroom to take a shower or clean off because it was taking a lot of time, was really helpful. Also, making it clear to participants what our policies were around calling 911, and what we were going to do and how we were going to notify them if the police were going to enter the space. Also, less big structural strategies, but more day-to-day strategies that we used to prevent conflict. We had someone sitting at the front desk looking at the drop-in as often as possible. We often had other people speaking with participants in the drop-in. We had our policies and procedures posted on our drop-in wall and in our hallways so people knew what they were. These are some small ways that we utilized to prevent conflict, as well as just as I said, building out relationships with our participants so that we weren't strange people coming out of nowhere to intervene whenever a conflict arose. All right, another step, or the second letter of SPLAT, or third letter of SPLAT, sorry, self-control, prevention, listen, right? So often escalation or conflict occurs because people don't feel heard, and this could be on both sides, right? If it's between, or all sides, if it's between two participants, if it's between a participant and a provider and a provider, multiple participants, police and participants, right? People often just don't feel heard. So as a provider, it is your role to listen first and then respond. This is really key. If you are not in immediate danger, your role is to listen and respond. People might be saying really hurtful things to you, but if they are not threatening you, it is not the time to correct them or tell them why their words are inappropriate. It is the time to say, okay, I hear you, and you cannot keep speaking like this because here is what will happen, right? It is not, you can't keep speaking like this because here is why I'm hurt. It's, you can't keep speaking like this, here's what will happen if you do. Do you want to talk about what you're feeling right now? And if you're the person they're having conflict with, you might not be the best person to talk about what they're feeling with, right? What they're feeling right then, right? It might be calling a teammate. You want to create a space for someone to express themselves safely. So if people don't feel safe with you, you're not the person to de-escalate that situation. It's essential towards moving to a resolution that people feel they're heard. So I know that often the way that we dealt with conflict in the drop-in space that I worked in was, if it was between multiple participants, we tried to have a staff person speak with each participant and tried to move them to separate counseling rooms if they were available, or take them on a walk around the block, or do something to remove them physically from the situation as well. So when you're listening, you want to maintain a calm and concerned demeanor. You want to have eye contact, but not too much eye contact. You don't want to be touching unless that's the relationship you have with the participant. If you don't know them, ask their name and introduce yourself before stepping in. As I said before, try to separate them from others to have a conversation, and let them talk. If they're yelling or screaming or snapping, that's okay. Listen and respond in a more calm way. So here are some strategies for active listening. Project calmness. Be aware of the tone, volume, and rate of your verbal communication. Speak firmly but clearly and slowly. Be conscious of your nonverbal cues. Are you making eye contact? Is your body eye contact? Is it too much? Is it too little? Is your body language closed off? Or your arms crossed? Maybe open your body a little bit. And if you can, introduce a trusted third party to the situation who can change the dynamics, right? So if I were working with someone around a conflict in our drop-in, I often would invite a social worker from our space into the conversation so that they could listen, and there could be that third party there who was not privy to the original situation. You want to encourage the person to talk and then listen closely and patiently. Acknowledge the person's feelings and reflect them back. So, wow, yeah, I can hear why that made you really angry. Don't bargain, don't make promises. Paraphrase the situation to make sure that you are hearing them correctly, and point out choices or options. Break big problems into smaller ones, right? So I hear you that you're feeling frustrated that someone stole those, or that someone took 2 soups. Can you talk to me a little bit about why you made the choice to yell at them about it instead of ask them why they were taking 2, right? And then stay with the person. Work with them until they've calmed down, and take appropriate time to address the situation, right? So make sure that you leave them calm. And this doesn't mean that everything has to be finished today, right? If someone's using hurtful language, the de-escalation period is not necessarily the time to correct it, but saying, hey, can you come back tomorrow or next week? I want to speak with you about what happened today when you've had some time from it is also perfectly fine. So, how do you not escalate? Well, remember TACOs. TACOs is another acronym we have. So these are things you should not do if the goal is to de-escalate. Do not threaten the individual. Don't say, there's a difference between if this continues, our policies state that you're going to have to leave, and if you don't stop doing this, I'm going to tell you to leave, right? Don't threaten them. Don't argue or contradict the individual. Don't tell them that they're wrong. Don't challenge the individual. Again, don't tell them that they're wrong. Don't order or command the individual. And don't shame or disrespect them. All right, sorry about that. I'm recording from home and my dog had a little bit of a reaction to the mailman. So, to review, TACOs, don't threaten the individual. It's fine to tell them what your policies and procedures say, but it is not okay to give them empty threats without any context. Don't argue or contradict the individual. Don't tell them what their perceptions are wrong. Don't challenge the individual. Don't tell them their feelings are wrong. Don't order or command the individual. Ask questions. Hey, can you come with me? Hey, would you like to take a walk? And don't shame or disrespect the individual regardless of how they're acting towards you. How do I need to adjust my behavior during conflict to make sure people can be heard when they voice their needs? Think through this. Think about how you respond to conflict, how you act when you're listening to someone who is involved in conflict, and think about ways that you might be able to adjust. I know that I used to really avoid eye contact, for example. And so now I make sure to make people feel seen as well as heard when I'm speaking with them about conflict. All right, fourth letter of SPLAT, adapt. Remember, it is not about, managing a conflict is not about what people in general need. It is what that specific person needs right then. Think about whether your structure actually allows these individual responses or the individual response in question. And if you don't, let them know that in a calm and neutral tone. Operate from a positive place with the goal of getting people what they need rather than ending the conflict. And focus on what you can do, not what you can't. So give people as many options as you can. So I'm so sorry. We're out of fentanyl test strips, and so I can't give you any. I can speak with you about strategies to stay safe with unknown product. I can call other syringe service programs in the area and see if they have fentanyl test strips. I can let you know when we get fentanyl test strips back in stock. So thinking through those options and being flexible and willing to adapt to the person and the situation at hand. Think through what behaviors or actions might make you or your organization resistant to flexibility, and what some ways are that people can adapt, that you can adapt to people's needs, right? So I know that certain structures that we had in place in the organization I worked at made it hard to be flexible, right? Certain policies and procedures that said when the drop-in was open, or even state policies saying like who could deliver syringes where, right? And we had to think through ways to adapt within those limits, such as referring them to other syringe service programs or setting hours that they could meet a peer who were able to deliver all over the city, or being really clear about what our hours were, things like that. And then finally, think. So when you're in a conflict, it is really easy to jump to moving with our emotions, which we don't want to do. Consider what the conflict is bringing up for you that can cause you to react rather than respond, as we've already talked about, and practice strategies for creating time to think during conflict, during small scale instances, right? So I know that where I used to work, we had naloxone drills. So overdose drills where we would practice responding to an overdose as a team. It might be a good idea to put in to place some conflict drills if that's something that you or your team really struggle with. And then I encourage you to think through what techniques that you can use to take time to think and ground yourself during conflict are. Again, I really like deep breathing. Maybe it is counting to a certain number. Maybe it is writing for a certain number of minutes or seconds, thinking through that. We talked about spatial safety a little bit. I'm going to talk about it more in depth. Become familiar with all exits of your facility. If you are in outreach, become familiar with all of the places that you do outreach. And when possible, make sure that windows, doors, and exits are free of obstruction, and that there's no furniture that is arranged in a manner that makes people feel locked in or cornered, right? So I know, for instance, our counseling rooms always had the provider sit with their back to the door so the participant could keep an eye on the door and know what was going on, right? And really, really, really think through your organizational policy on when to call the police and make this clear to participants. For instance, at my organization, we called the police. We had to call 911 whenever there was a medical situation, and often the police would be the first to respond. Other than that, we did not call 911 unless there was a clear and violent threat made or a weapon or a fight happening, physical fight. And we made that all clear to participants. We also, when police were called, had to shut the drop-in so as to protect folks who might have been recognized for warrants that they had out. And so we made it really clear when we called the police or when we called 911, hey, 911 has been called, we are shutting the drop-in. Or right now, we will not open it back up and you will not be able to leave until the police are gone. You can leave now if you choose, right? So making that clear to folks, both in the moment and well ahead of the moment at the point of intake. Because as we know, calling law enforcement can often lead to unexpected, unintended, and really, really dire consequences for many participants. As I mentioned, some participants who aren't even involved in the conflict might have warrants out for their arrest. Participants who are involved in the conflict might be really hurt by the police. And going to jail might mean that they go into withdrawal or they miss their methadone clinic in the morning. For a lot of folks, the presence of police escalates a situation rather than de-escalating it as well. It really, really, really should be a last resort for truly dangerous and life-threatening situations, right? So when I talked about this, our organizational policy on when to call the police, I said clear and present threats of danger, the presence of a weapon or intense physical fighting, right? We called 911 whenever there was a medical emergency. And a lot of times police did show up. And so we let people know, hey, we call 911 in the instance of a medical emergency. We call the police specifically in these other 3 instances. And if we call 911 and you are in the drop-in, we will always let you know. So be clear with participants. And then after the situation is over, talk about whether there was adequate staff support and what kind of support you need from the rest of your team. Create a process for debriefing. We would, after a conflict was managed, we would set time to meet and debrief. Have a clear accountability process, both for you and participants. When we did intakes, made our policies around banning or suspension really clear to participants. And we also gave participants a chance to appeal any disciplinary decision that was made, and then talk through next steps really clearly. So this is the time to talk through what you need to communicate to the participant that might be more of a teaching thing rather than a de-escalating thing, right? Or what you need to reiterate about your policies and procedures with these participants, right? So I'm studying through. It's really, really, really important in every conflict that you maintain personal safety. You cannot de-escalate a situation if you are not safe. So trust your instincts. You know very quickly if your de-escalation tactic is beginning to work. If you think it's not working, stop and make sure that you're safe. Making sure that you're safe can look like a number of things. It might look like leaving the situation. It might look for like calling for assistance from a teammate. In very few cases, should it look like calling the police, but again, in very few doesn't mean a no. And physical force should be an absolute last resort. You should be making every effort that you can as required to not physically harm or attempt to harm a participant. So let's talk through some scenarios. You hear screaming coming from the dining area and rush over to see a participant yelling at a staff member who is standing with their arms crossed, glaring at them. As you walk in, you hear the staff member say in a teasing tone, well, maybe you shouldn't have used drugs if you didn't want to deal with the consequences. This sets the participant off even more. What do you do? What do you do in this scenario? For me, what I would do is say to the participant, hey, do you want to come eat your meal? I'm coming from the dining area, sorry. Hey, do you want to come take a walk around the block with me and talk to me about what's happening here? And as I walked with them, I would text a supervisor to let them know what I had overheard and ask them to speak with the other staff member. If they decline, I would say to the staff member, hey, do you want to take a walk and talk about what's going on? But making sure that both parties are speaking with someone and being heard in this scenario is most important. And then another scenario, a resident comes into the building after work. They're yelling and crying about how their bag was just stolen on the bus. They are incredibly angry, threatening several people, saying that they know the thief is a friend of another resident and they will kill him when they see him. The resident also knocks some papers off a desk and kicks a chair, causing a loud disturbance in the office. What do you do? Now, in this scenario, someone is moving into aggression, right? They are certainly past the point of feeling anxious, definitely feeling belligerent, moving into aggression with the knocking of papers and the kicking of inanimate objects and being loud, right? So I would say firmly to this person, you need to go to your room. They're a resident, they live here, right? We can't kick them out. You need to go to your room right now. I can come with you and talk about this situation if you'd like. Or I can give you some time to cool off and check in with you. But I'd really like to hear how you're feeling and why you think that this person stole your bag, right? And then I might speak with them later on about calling the transit authority and seeing whether their bag was found on the bus, about why they think that person was a thief, right? But the most important thing in that moment would be getting that resident to their room, speaking with them calmly, going to their room with them, hopefully with a third party, or allowing them space to process and talking with them later. But you may come up with some other solutions. We're almost done. Here are the biggest take-home messages I want you to take away from today. Create a connection with your participants. Create a connection between staff and participants. Recognize what escalation looks like and note all cues: physical, verbal, mental. Communicate clearly with participants and other staff members, and be aware of your surroundings and how they impact capacity for conflict to develop. Thanks so much for spending time with us today. Harm Reduction Coalition and Behavioral Health Services Baltimore, thank you for participating in this webinar. All right.